To administer nitrous oxide, review the health history, take vitals, and explain nitrous oxide administration to the patient and get consent. All units are slightly different, so be sure to check the manufacturer's recommendations. But in general, you're going to start by choosing the correct size, single-use nose or nasal hood, place the nose onto the tubing, and check the scavenger system, which helps remove any excess nitrous in the room so it doesn't affect you as the clinician. Then turn on the oxygen, usually labeled green, and turn on the nitrous, usually labeled blue. Push and hold the flush button to add oxygen to the reservoir bag until it's about 2/3 the way full. Then you're going to place the hood over the patient's nose and tell them to breathe through their nose and not through their mouth. Have the patient adjust for a snug fit and check for any leaks. If there are any leaks, you can place a piece of gauze at the top of the nose. And never leave the patient unattended. Next, you're going to determine tidal volume by giving oxygen at around 6 liters per minute for an adult and about 4 to 5 for a child. Look for the reservoir bag to be easily breathing, kind of like a lung. If the bag is bulging, then they're not breathing in the oxygen fast enough, so you're going to want to turn that liters per minute of oxygen down. And if it looks empty, there's not enough oxygen in there, so you're going to want to turn that liters per minute. It should stay around that 2/3 of the way full at all times. Once you determine liters per minute, you will always keep it at that level. For example, my next step is to raise nitrous to 1, so I will bring my oxygen down to 5, always keeping the total liters per minute at 6. Leave the patient at that level for 1 minute, and then you're going to increase in half increments. So as I go up to 1.5, I bring the oxygen down to 4.5 for 1 minute and continue titrating in half increments like that until the patient reports ideal sedation, which is around 15 to 40%. To determine this percent for documentation, you're going to add oxygen plus nitrous together, so 6. Then divide the nitrous amount by the total number, so 2 divided by 6, in which case this is 33%. Do not exceed a maximum of 70% nitrous. 3 to 5 minutes before my procedure ends, I'll turn it to full oxygen for the effects to wear off. I'll obtain vitals again and have my patient report that they're feeling well before I dismiss them. Then you want to disinfect everything according to the manufacturer's recommendations, and finally document the procedure.